Hello and welcome. You are watching Freeology revision. In today's video, we will be doing a quick revision session, covering everything that you need to know about the psychopathology topic in just one video. On screen now, you can see all of the information you need to learn for this topic. Feel free to just sit back and listen, or watch along to see our notes too. Topic 1. Definitions of abnormality. There are 4 ways of defining abnormal behavior. Number 1. Statistical infrequency. When plotted on a graph, a variable such as IQ will show a normal distribution, also known as a bell curve. Extreme values define what is abnormal. For example, people who have an intellectual disability have an IQ 2 standard deviations below normal. Evaluation. Some extreme behaviors are desirable, for example having abnormally high IQ. Cut-off point is subjective. Important for deciding who gets treatment. Some characteristics regarded as abnormal are common, like depression. Number 2. Deviation from social norms. Norms are defined by society, either unwritten rules or laws. Evaluation. Relative to each culture. Varies with changing attitudes. Can be used to incarcerate nonconformists. Number 3. Failure to function adequately. Unable to manage the everyday life, like eating regularly or maintaining hygiene. Evaluation. Psychopaths are mentally ill but are able to function well in society. Coping may be subjective. Number 4. Deviation from ideal mental health. Humanist approach. You can remember criteria with the acronym ESPA. Environmental mastery. Autonomy. Resisting stress. Self-actualization. Positive self-esteem. Accurate perception of reality. Evaluation. Positive and encourages development. Unrealistic criteria. Imposed ethic because autonomy may be less important in collectivist culture. Topic 2. Phobias. Characteristics of phobias. Emotional, excessive fear, anxiety, panic. This response is cued by a specific item. Behavioral, avoidance of phobic object, fainting or freezing, interferes with everyday life. Cognitive, not helped by rational argument, but the unreasonableness of their behavior may be recognized. The behavioral approach to explaining phobias. The two-process model. Phobia is acquired through classical conditioning. Through acquisition, the phobic stimulus becomes associated with an unconditioned response. For example, being bitten by a dog causes unconditioned response of fear and the dog becomes a conditioned stimulus. The phobia is maintained through operant conditioning. Avoiding the phobic object reduces anxiety, negative reinforcement. Social learning theory. The phobic behavior of others is modeled. Especially effective if the model is rewarded with attention for their phobia, vicarious reinforcement. Evaluation. Supported by key study. Little Albert conditioned to fear white rat, paired with loud noise of hammer banging. Also began to fear other white fluffy objects, stimulus generalization. However, study is unethical. Theory useful as applicable to real life. Useful treatments like flooding and systematic desensitization created. Theory cannot explain all phobias, suggests phobias occur through nurture, past experiences, but biological evolutionary explanation contradicts this. Nature. Many people cut themselves on knives while cooking, but not many have a fear of knives. Meanwhile, others live in countries without snakes but fear them. Suggests phobias evolved as a way to increase survival. The behavioral approach to treating phobias. Counter-conditioning is when the conditioned response of fear to the phobic object is replaced with a new response, like relaxation. Causes extinction of learned association. Based on the idea of reciprocal inhibition, relaxation and anxiety are two opposite emotions and cannot be felt at once. Systematic desensitization. A desensitization hierarchy is made, from least feared situation to most. At each stage, relaxation techniques such as breathing techniques until relaxed. Stepped approach. Evaluation. Study found 75% of patients respond well to systematic desensitization. May be expensive and take many sessions. Require highly trained therapist. Flooding. Exposed to maximum fear situation. for example having a fear of planes and being put on a plane. Continues until adrenaline levels naturally decrease and person realizes there is no real danger. Can be in vivo, real, or in vitro, simulation. Evaluation. May cause heart attack. May make fear worse if patient bottles it or something goes wrong. Quicker than systematic desensitization. Topic 3. OCD. Characteristics of OCD. Emotional, anxiety and distress, and awareness that this is excessive, leading to shame. Cognitive, recurrent, intrusive, uncontrollable thoughts or obsessions, more than everyday worries. Behavioral, compulsive behaviors to reduce obsessive thoughts, rituals, not connected in a realistic way. The biological approach to explaining OCD. The genetic explanation. OCD is associated with low levels of serotonin and high levels of dopamine. There are 2 genes you need to know about, CNT and SERT. The CNT gene is involved in the production of an enzyme called catecholomethyltransferase which regulates the production of dopamine. If this gene is mutated, the protein it produces is faulty, resulting in high levels of dopamine. The SERT gene usually transports serotonin from the synaptic cleft to the presynaptic neuron. However, when it is faulty, lower levels of serotonin are transported. As it is unlikely that a complex behavior such as OCD is caused by one gene alone, a more realistic and holistic explanation may be the diathesis stress model. Each gene only creates a diathesis, a vulnerability, for a particular disorder. Other factors, stressors, affect what condition develops or if any mental illness develops at all. Neural explanations. The orbitofrontal cortex is responsible for sending signals to the thalamus about things that are worrying. When the caudate nucleus is damaged, it fails to suppress minor worry signals and the thalamus is alerted, which in turn sends signals back to the orbitofrontal cortex, acting as a worry circuit. Serotonin and dopamine are linked to these regions as unusually low levels of serotonin might cause these areas to malfunction. Also, dopamine is the main neurotransmitter of the basal ganglia, the area of the brain where the caudate nucleus is located. High levels of dopamine lead to overactivity of this region. Evaluation. Support for genetic inheritance of OCD. One study compared 73 controls with 80 OCD patients. People with a first-degree relative with OCD had a 5 times greater chance of having OCD. Further support comes from twin studies. A concordance rate is the probability that a pair of individuals will both have a certain characteristic, given that one of the pair has the characteristic. One study found monozygotic, identical, twins showed a concordance rate of 87% for obsessive symptoms and features compared to 47% in dizygotic twins. However, concordance rate is never 100%, suggests diathesis stress model better. The OCD may be transmitted through social learning theory instead of genetics by modeling behavior of OCF family member. Family members might be more vulnerable to OCD because of a similar stressful home environment. Biological explanation applicable to real life, used to create effective drug treatments like SSRI. Antidepressant drugs, SSRI, that increase serotonin levels have been shown to reduce OCD symptoms, but antidepressants that have less of an impact on serotonin do not reduce OCD symptoms. Biological, drug, therapies for OCD. Antidepressant drugs, SSRIs, selective serotonin reuptake inhibitors, are commonly used to treat OCD. Increase levels of serotonin. They inhibit the reuptake of serotonin into the presynaptic neuron so it stays for longer in the synapse and enough can bind to the postsynaptic neuron. May need 3 to 4 months to work. Another drug that may be used are tricyclics. They block the transporter mechanism that reabsorbs serotonin and noradrenaline. However, have more side effects so are second choice of treatment. Anti-anxiety drugs like benzodiazepines also used. These enhance the activity of the neurotransmitter GABA. GABA binds to receptors and increases the flow of chloride ions, making it harder for the postsynaptic neuron to be stimulated. Slows anxiety signals in the brain. Evaluation. 17 studies were reviewed. Found drugs more effective than placebos in 3-month trial. However, most studies only 3 to 4 months long so long-term effects not known. Drug therapies are preferred to other therapies such as OCD because cheaper, don't require trained therapist, less time consuming. There are side effects. Less severe with SSRIs, insomnia, headache, nausea. More severe with tricyclics, hallucinations, irregular heartbeat. Topic 4. Depression. Characteristics of depression. Emotional, negative emotions, sadness, loss of interest, anger. Behavioral, reduced or increased activity when it comes to sleeping or eating, weight gain or weight loss. Cognitive, irrational, negative thoughts about self, world and future. These may be self-fulfilling. Cognitive approach to explaining depression. Beck's negative triad. A schema is a mental model of what to expect from a variety of experiences and situations, acquired from past experience. Negative schema developed in childhood, for example from parental rejection, creates a tendency to have a negative view of the world. This causes a person to develop a negative triad. A negative schema of the self, I am undesirable, world, everyone hates me, and future, I am doomed to be alone forever. Ellis's ABC model. Activating event. Failing a test. Belief. May be rational, I did not revise well, or irrational, the teachers are out to get me. Consequence. Irrational beliefs lead to unhealthy emotions. Masturbatory thinking. People have unrealistic expectations about how the world should be, which must be true for us to be happy. For example, I must do well or very well, or I am worthless. Evaluation. Caused the creation of CBT, a successful therapy. Ellis claimed there is a 90% success rate over 27 sessions. Support for irrational thinking comes from study where depressed female undergraduates made more errors in logic when interpreting a short story compared to a control group. Some irrational beliefs may be realistic and depressants may see the world more clearly instead of through rose-tinted glasses, known as sadder but wiser effect. The cognitive approach to treating depression. Cognitive behavioral therapy. Talking therapy. Based on the cognitive assumption that psychological problems occur as a result of irrational thinking, and in order to change how we feel we must change irrational thoughts into rational ones. Activities, homework, set to change behaviors. Based off of Ellis' ABC model, with 3 extra letters added. D, E and F. D equals disputing irrational thoughts and beliefs. Ellis categorized 3 ways of disputing irrational thoughts. Logical disputing. Self-defeating beliefs do not make sense, they are illogical. Empirical disputing. Self-defeating beliefs do not reflect reality, there is no proof that this is true. Pragmatic disputing. Self-defeating beliefs are not useful, how is this helping you? E equals effects of disputing and effective attitudes to life. F equals new feelings that are produced. Between CBT sessions, patients are often given assignments to help them test their irrational beliefs against reality and practice implementing new rational beliefs. Behavioral activation is often encouraged. This requires patients to actively re-engage in pleasurable activities. An unconditional positive regard is given by the therapist. This reduces the patient's sense of worthlessness. Evaluation. There is research support. Ellis found 90% success rate over 27 sessions. Benefits to economy. Helps people to control mental health, therefore fewer sick days and may be more productive while in work. 16 to 20 sessions are recommended. This is a considerable time investment, may cost money, requires a trained therapist. Therefore drugs may be easier.